March is Kidney Cancer Awareness Month. According to American Association for Cancer Research, cancer of the kidney is among the most common cancers in the United States. And joining me now is Dr. John Haluschak, Medical Oncology with Premier Health. Thank you so much for joining us this afternoon. We're going to start with, are there different cancers that attack the person's kidney? And if so, what are they?
Well, the majority, 70%, are what are called clear cell, your typical kidney cancer. Then there are some other less common types. The other reality is that they tend to be slow growing, kidney cancer as a rule, and it is not part of the collecting system where the urine gets out of the kidney. That's actually more of a bladder type cancer, different month.
I see. So can these be genetic or something else?
About 10% are hereditary.
Okay.
There are 6 different hereditary syndromes, and if you have those syndromes where there's been multiple members in your family with kidney cancer, you want to get screened properly for that. Otherwise, the majority are not. They're generally hit in 60, 70 years of age per people.
Yeah, and so often we hear with really any types of cancer, it can be so hard to detect until sometimes it's too late. So what are the symptoms of forms of kidney cancer?
Yeah, the most common symptoms surprisingly is blood in the urine. So you want to, there are other cancers that can do that, like bladder cancer, but blood in the urine, pain where your kidneys are, which are on either side of your abdomen, kind of higher up under the ribs. And then if weight loss, too often is diagnosed later, but these days often is diagnosed almost incidentally or accidentally because of scans done for other reasons.
Now, are there age groups that should be more tuned into this?
Probably the age 60 and 70.
Okay. And how can people get treated for kidney cancer?
These days, fortunately, the majority are actually cured by taking out part of the kidney or taking out the whole kidney, or you can ablate the kidney. If it's more advanced, we often use immunotherapy and targeted therapies. We don't really use chemotherapy these days.
That's interesting. So the million-dollar question, are there measures people can take to try and prevent kidney cancers?
The most common causes are considered smoking, obesity, being on dialysis or having bad kidneys, and high blood pressure. Those are the big risk factors.
All right. Well, thank you very much, Dr. John Haluschak, Medical Oncology with Premier Health. We appreciate your time this afternoon.
You're welcome.